to His Majesty the King, the Right Honourable the Prime Ministers, two House of Lords, and of course the Cabinet, my Honourable Minister of Health who is coming. He's going to join us, and I'm pleased to welcome our visitors from the Starlight Oasis of Hope and others that are partnering with us in this very important issue and very touching subject. As we all know, palliative care is lagging behind. We need to raise awareness. We need to raise awareness and make people understand that palliative care is not only about cancer patients. There are a lot of chronic diseases where people at the end of it needs palliative care. And all of them, it's not like they are neglected, but they are so marginalized. Their services are so scarce. And all of us, it is time we make sure that their services are available. Most importantly, we need to prevent and make sure that we reduce that number, because we all know how difficult emotionally, physically, financially, and otherwise to manage that. So if all of us, we can say today through primary health care, we need to get all of them to care and make sure we raise awareness for prevention, management, early screening of non-communicable diseases. I am sure that's where the bulk of the issue is coming from. So let's raise awareness for palliative care. Let's raise awareness for no discrimination, because they are hidden there in our households, we know. It's even sad to see that even children who needs palliative care are left behind. So it is very, very important as we have organizations, be local, international, that are willing to help us, to also acknowledge that there is a gap here and we need your help. We need each and everyone's help. Let us not wait when I have a patient who needs palliative care for me to understand it. It is very difficult, both emotionally, physically, to manage that at the household level.
Empa kgothaletso ya ka nna hore ha ile mona eba o tla go le letsweleng eba ha wa feta kore le tloswe hanyanyana ka tswa ka nna we ne ke le motho a di-cleavage ka nako eo empa le teng ka a tjhe go lokile ntate a re we are x-ray re lo sheba matshwafo re lo sheba le kampeng ko re ta sheba dibaka tsohle. Me ka lehlohonolo ha fumantshala hore ha hona dintho tse sitisang hore nka etsa operation hae mona tsebo le la tloswa tswele ha ba ka lehlolelo ha le tloswa mohlaki ne ke lo tlosa letswele le sentseng ke nkile bo ya hore e tere ha ke tswa sepetlele se se ke ka tla ke sika ya ba letswele ha le tlositswe ke nahana hore nna ka botho cancer e fedile. Ha sentse ke tsamaya ya pele hwa tswa o tlo tshwanela go ya Bloemfontein jwale ka lebaka la ho ba neneng ha hona bahlabudi ka nako tsena tseo re ntse re hlahlojwa o motho o inkela diketo e le wena empa he le hlonela gore ha re le batho ba tsebang gore re a rapela o utlwa o ntse o na le tshepo ho ba neneng o tshepile modimo fela nnete e sala bahlabudi ha ba mme ke le ka Bloemfontein ha ke fihla teng ka jetswa ka chemotherapy ka jetswa ka radiation ka re jetswa ka dipilisi tse bitswang tamoxifen ka o fela tsona ene le hitla ho nna ditaba tseo mpa fela he ntse ke ithuta ka hore ha ntse di bolelwa e be ntse ke ithuta wa bele se le ntho tse tlo sebetsa ho nna bo mele bo tate ha ke batla ba motelele fela ke batla ho jetswa go chemotherapy ke engwe e etsang hore ko go motho a ka iphumana a ko a lahlelwa ke bophelo ka lebaka la hobane e mong ha je ho thata ho ja ha ona le motho a ka ba o kgethela na o jeng empa he le ha o le jwalo ke le ka diballwa dikimo tse tshiletseng ke le ka diqeta le ha ile a re ka nako e nngwe ho ya bohlano ka bolellwa hore tsatsing leno no ha ke no tshela kimo madi a tlase ke kgutlele hae ko ja hantle jale sontse o utlwa hore na ha ba o kgutlele hae o ja hantle o le maserung hae ba o tswa madibeng ha e sukwa ho kgutlela madibeng o ja hantle o tsamaya jwang kang o etsa jwang o tla kgutlaneng ke tse ding tsa dintho tse re tshwanetseng hore ke di tsebe hore e hlile ke qholotso empa he ile a tshelwa e le hore bakeng sa kgwedi tse tsheletseng ke ile ka atoloseha ho ya kgweding tse supileng le ha o le jwalo ke ile ka ba ka tla radiationeng yona ile a tlankimela ha ke batle ho lethetsa ile a nkimela haholo ya ba ho tloha moo e ba tamoxifen ke leng ka e sebedisa dilemo tse 5 pidisi ile nngwe ka letsatsi ha ke so bone ntho e lahlisa motho kelello jwalo mme Dineo le tjena ke tlabe ke re nahana ne ko bona kae hana o mang ke bone ka ne ke mmona mohlomong ke re keng ka Mokhothane ntse ke mo tseba le bana ba ka ke le bala le mabitso a bona gore e ne le ntho e thata bona bo empa ho a fetwa ho thuli yona ena e tla feta ile ka feta ke le ka fumana mosebetsi ha ke fumane mosebetsi ke na le kgwedi tse 3 ho tsile sepetlele ke dumela hore mokamedi wa ka ona sa utlwisisi ba le interview ke le ka itlhalosa hore ke motho wa kankere ke a nahana ke a monahanela e bile kutwa ka ke a motshwarela ona sa utlwisisi hore ke tla ba le diqholotso tsa ho lebala ke hlile ke ne ke lebala mme mosebetsi la mphella ka la ho lebala ho motho e mong ya ka reng yena ona re ke molotsana hobane ka nako ngwe tla ga mpotsa ntho mona ha ke tshwanela ho ya gaba ha ke tsebe na ho etsa haleng ke thole ke itshware seledung kore ha ke tsebe na ke nkeka bona itseng kore bo lebadi bono bo jwalo jwale ke sentse ke bua tjena hore ho tseba hale hore le bahiri ha bana le motho ba mofuta ono o ba mpe ba motshehetse le metseng ba haisane le batho bohle ba tsebe hore motho wa mofuta ono ka nako tse ding a ka thwi o bonwa ntsa tsikela hohle mo motho utlwang hore o sontso tseba hore ke tla re le haeba jwale ke bona hore se ke betse ke sukudisa mohlomong cancer ya khutlile ya pa ka mokotlana ka ko ema palliative care man motho o nkgonenwa ke yane shame ana hlotse ya bua ka cancer mehlae mme ba tla bona hore
o ntsa tla setolo ka le sona sena jwale ke kopa ke tle ke se bane. As I've said, my name is Madavida. I am representing National Health Training College. I am with my other, should I say students, from college. First and foremost, I would like to express my sincere gratitude to our esteemed Master of Ceremonies for granting us the opportunity to address the remarkable gathering. We extend our heartfelt appreciation to Starlight and its partners for their unwavering commitment to the academic sector, particularly in the context of hospital and palliative care training. As nursing institutions, we do have elements of hospice care in our curriculum, but it is to a very little extent. Like it is covered slightly in HIV. They may not even remember that we talked about it. It is also covered in elderly nursing care. But we have always been aware that our patients are suffering to some extent, and the training we received from the hospice have opened our eyes to a broader perspective on this issue. During the training, we had the privilege to exchange experiences with our colleagues in the clinical setting and across various disciplines, leading to the profound understanding of the intricacies of hospice and palliative care. It's worth noting that healthcare providers also experience fatigue due to patient suffering, emphasizing the need for self-care to prevent burnout, which could ultimately affect patient care quality. We deeply value the opportunity for this training and believe it will lead to improved healthcare provision in our institutions. I would like to thank you very much for the attention and the support. We have our learners here. Maybe that Sejojo will want to interpret before NHTC learners can come in.
Bye bye. What about the hand that Baba Mono just let us la hella hold? Who got here? Hey, take a look at it. Gana. Oh, come on, Anna. And the Baba and the Tapo. Good day. That's how I was at Cafe at the Lemang Holumu.
I can see the boy 2 minutes and I take you over the ones. Oh, the house of honor, we are taking man who puts Empire on all the vessel and the Buavana, soon 10 sinner. Bahoma 12. Every Tebello Sepo. Lema chenye Meli theater below. Ya support la handle below is. Emme tini yini tsina fela.
Oh, ga se bua hlanta tsa tshepo. Ntse batla ho empa fela he ho bima. Ne di rontsho. Mo sa moratu. A o menne se ho bua se le bothata ke go kwehlese le go bobola fela.
O ja teng na ntse.
Kopa go buela ka sethongo mo kamane. Go molahela go tla go bona pele re tsamaya.
Bona go fela a nkebe sitimana lo tla fuwa ka la fena o tlo Hospice care. Mo teng a tla a hlokomela official la se a itlhoka le ka go. O bana mo lo tla hlokomelwa ke baoki. Lo lona ntse ya lo motlhakere empa ha o bane ntse re sena sona setisheno sa Hospice. Ntse re fana ka yona ha mo teng ka tla re tisa ba mo di ka ba bana ba tota ba fana ka tlhokomelo a thuso mo le lona le setšhaba ka kakare.
Ho bane ba le ke hlokometse le hore di tlhage tsena tse le mo fileng tsona le bohloko ha go ga di sa theola bohloko itse go so tshwana lantsa a nwa ntho ke sa itse dife e sa mo thuseng le mo thuse
Ke hopela hona le ha motho tsa fela o bona o ke hlana go bohloko. A tsa bonneteng teng la ntse re le ka gore ka nnete re kokobetse bohloko re ntse re mo fa di bo di phanado bo di tramadol ha di sa thusa tsona bo bongwe ntho e seng e hlokala ke setlhare se bitswang morphine la ile go na le tlhokalo ya sona ha rali empa he re tla le ka gore re etse re se batle re tle re skineng shopana
ha se yo sitting di ka o fela ka boihle ha se yo wa
a go na le tlhokalo ya sona go na le mo selinteng go na le mo seleng siko ka he re tla etsa matsapa ohle
le o di mo so jalela ka se ke mo fini hona ba
jwale tabeng eo ya gore mme a tla fumane tlhokomelo ya Hospice care le ka lanka qeto e feng gore go tle mooki mo letsatsi le letsatsi ka mokgwa le tla hlophisa ka teng kapa a tlatle a hlotlodula mo
hai ke nna che maikutlong a ka bana ke hlokometse la o shega o sa sutwa go bona mabaka le nna hle se ke hlola lo popanyana a tsa ha ka dula le gona mo ke nana o tla ba betere re tla le re thusaneng
o mo ke a tla mona
mona hle ke tla tsa ngwane yeso ka nnete go ba he a ke re tshelo kulele lona ha le kena ka mo Hleo ho se hao.
Ana go thata he go tla hlophisa tabeng ya mo ke a tla ka matsetse hona o tla hlophisa ka teng a kere go boela hape mo tshebeletsong tsa hospice hona le
le mpa fela le go fela le nne le tsere kenonyana la di-campus mo e hlile ga di tlhoka madi ana e hlile a sa tlatsa ka pelenyana
dihlophiso di tla etsuwa ka nnete
Ga le bua ka nnete mme National Happiness.
thank you
Thank you. Halashina wona wona direka file le biso ke Fumane ke tsene HTC Poemi is a margin. I am slowly fading away. Death has set up permanent residence on my doorsteps. It could be any minute now. A part of me begs for more time. Another bargains for more days. But what is more time for a dying person like me? So as my hands still have strength, I write to whom it may concern that we need more sanctuaries in our country to house people whose bodies are fading away, those whose systems are slowly failing, those who cannot do it on their own anymore, those who have unintentionally become a burden for their families and loved ones. We need a mandate that pushes for more training of palliative care nurses. We need a mandate that forces us to educate our communities so that we may have more heroes to carry the burden, to offer compassion, to care and love with dignity and respect fit for the kings. As my lips still give me words, allow me to plead with those in power, to donate, to give, to offer, and to pour into the palliative care system. Thank you.
A neighborhood called Upper Tama in Masemu. I'm an architect by profession, I'm a mother, I'm a wife, I'm a wellness coach, I'm a great lover of my heritage. The Monset Basotho, we are celebrating 200 years of existence as a nation. Basotho bicentenary, and that means a lot. When initiatives like this happen, it is such an encouragement to say the legacy of Moshosho lives on. In my culture, a patient of our neighborhood is the patient of the entire neighborhood. You heard I'm far away, I'm not anything close to what the medical profession does. I'm merely a friend of Starlight. I'm here to join forces in giving hope and compassion. And therefore, I'm here to invite you all. Let's all come and be friends of Starlight. What they are doing is a mammoth task. Kasi sutune retare kgomo e wele. Re boetse re le tshele le beta poho. Re hloka e mong le e mong. Ha ho tsotelle na botsebi ba hao ke baeng le ha o sena bona. O ile hona le nako ntate ana le tsietsing ho thwe mokudu wa hae o hloka madi. Ha ba o ntso tsamaya ho hema le madi o na le ona. You can give anything. Ho thwe tshepo, tong re tlo fanang ka tshepo. Re faneng ka qenehelo. Re faneng ka tlhokomelo. Tse ding tsa ntho tsena di tshwarele ka matsoho. Ho bontsha qenehelo ho ya tsietsing ho ya e hlokang. Ho mo fa matla ho ya pele maemong a leng ka hara ona le ba mo potapotileng. with the assistance of my colleagues, fellow architects, fellow engineers, quantity surveyors, we were able to pledge our expertise to Starlight to assist them with the design of their proposed Starlight facility, which is supposed to be built in Makaka. The site has been acquired. Processes are underway for formal authorizations for construction to happen when the organization is ready. But Starlight has been started by one of us. She's a mere nurse. Sorry for me to say that, allow me to say it. She has a family. She earns what I earn. She earns what you earn. She just has a big heart and a good heart for our nation and for its welfare. So it compels all of us to come on board and make sure that the dream she has for the welfare of Basotho, it's realized. And in her wisdom, she's not waiting for the walls to be there. She's doing a lot already. She's training. She has, with the support of her medical friends from all over the world, just this past 7 weeks, she conducted an online training on palliative care, hospice and palliative. And even I, not being a medical person, I joined in, and I'm highly appreciative for you, for Starlight, for having organized that training. This is just to show you that we all can play a role, and I'm highly appreciative that I took part in that training, but it is not the end. It also means I have a duty now to go and share what I've learned with others. The more of us, the better. Let's again. But over and above that, as we move towards construction, can you make a plan that one brick for putting up this facility will come from my household? Mohlomong setene saka, sa ngwanaka, sa monnaka, sa mme ya thusang, sa ntate wa jareteng. Together we can make it happen. So I'm here to invite you. Let's all be friends of Starlight. The beautiful nurses, student nurses, thank you for the beautiful play. You continue to teach us. You are duty bound to be part of this initiative. But over and above that, I also invite you to be friends. You will be very special friends because of the expertise that you already have. So let's make Starlight a reality. In that design, you spoke about accommodation and care for cancer patients while they are waiting to be taken to Bloemfontein. In that design, there is interim hostels. And we wish to thank the Ministry of Health as well for being on board, for hosting this event, and for leading that project. I know how much the leadership of this ministry is passionate about that project. I know how much they fought for the project to be given the budget for this year, and not forgetting our one and only soldier, Dr. Mphunyane, our one and only female first Mosotho oncologist, whom in the absence of the radiotherapy chose to set up at Sankata the chemotherapy facility. That should be acknowledged, and it gives such an encouragement. So a lot is happening. Mediji, when she started, she talked about partnerships. We need partnerships. When we say come be friends of Starlight, always saying come, let's be partners and work together.
Of our breath deserves to be acknowledged, appreciated, and uplifted. If it wasn't for him, nothing like this could have come to this stage. And therefore, we want to acknowledge him. Let him take the stage from now onwards. I want to acknowledge the presence of Dr. Banda, our country representative from World Health Organization. That day, we appreciate your presence. Thank you. We appreciate in that day, Harry, His Excellency, that day, Harry MacDonald from the United Kingdom. That day, Hassan, we thank you. We know you have patience, but you made time. We thank each one of you. Our nursing school, you were supposed to be in your lessons, but you made time, and we appreciate the message that emphasizes why we need palliative care and hospice care. Today, as a nation, we are commemorating World Hospice and Palliative Care Day, which should have been celebrated on the 14th of October. Is always held on the second Saturday of October. And this year's theme has been around compassionate communities together for palliative care. That is to say, all of us working together with a different expertise, different sectors and age groups, but having the heart to care, compassionately sharing our time and effort to support each other and one another. But I want to appreciate Dr. Paul. Dr. Paul is Dr. Paul Myres. He will introduce himself, but I want to really thank him. He is the chairman of Starlight Oasis of Hope Hospice. He is the gentleman who has the heart for Lesotho. Through other charity, he's been part of Lesotho for over so many years, he will tell you. But the area which I always feel humbled about is his passion for palliative care for the people of Lesotho. I was desperate, really didn't know what to do, struggling from 2017 to get this vision off the ground. And I was approaching so many different people to support the vision. And many were just thinking, it's just too much of a big dream that can never see the light of the day. But on a first email, he captured the vision with the understanding, and since then, the journey has been continuing. And I thank you and your family, because it's not just him, his whole family is in it. He has left the family now just to travel to Lesotho. He has done it before, and his great investment in this initiative is mind-blowing. I shouldn't even start to go there before I start crying. Anyway, I am Tebello Malichaba Lepheane, the daughter of this land, born and bred in Smongo by my own grandparents, born as the only child of my mother and father, who are no longer with us. But I want to surrender this moment for Dr. Paul to say his part. I'll come after him.
thank you very much for walking with us. What a great walk, and how wonderful to walk behind that amazing band and to hear all your singing and your enthusiasm, and for staying to listen to us talking for the rest of the morning. So my name's Dr. Paul. I'm a family medicine doctor from Wales, and I've been practicing palliative care in the community as part of all the other aspects of looking after people with health problems for 30 years. I'm retired now. That's why I look fresh. If I wasn't retired, I'd be... Because it's hard work. We know it's hard work. But one of the most rewarding parts of my work as a family doctor was palliative care. When I was a medical student, we were taught about diagnosis. We were taught about pathology. We were taught about bacteriology. We were taught about drug treatments. We may have heard a little bit about physiotherapy. And I realized what was missing. We weren't told about emotions. We weren't told about the value of families and social support. We weren't taught enough about the value of work. I now know that actually being in a job is one of the most health-giving features of life. Work is important. Family life is important. Community life is important. And it's as important whether you're fit and healthy or whether you're ill. Whether you've got a short-term problem, like a broken leg, or whether you've got a long-term condition, like diabetes or cancer. My wife has cancer. She had cancer when we were a student and had to interrupt her medical studies to have treatment. But she managed to train as a doctor and as a very caring doctor. I'm very proud of her. She had treatment again. She has a horrible scar down her neck from where they had to remove the cancer and where they tried to repair it. She had radiotherapy, which damaged her throat and her vocal cords. So now she can hardly speak. I'm deaf. So just imagine the sort of conversations we have. What? Eh? It's difficult, but I know that if the future means that things get worse, that in Britain we have palliative care. And I know, having worked as a family doctor for many years, the difference that good palliative care makes. For a long period of time, right at the start of the diagnosis, right at the start of the cancer journey, right through to the time when somebody can no longer look after themselves. And I noticed the value of working as part of a team with social workers, with community nurses, with the administrative staff in the clinics who often know these people, working with the family, working with other colleagues with different expertise, that working as a team is just so important and makes a difference. And that's why I'm very committed to see the Mountain Kingdom benefit from this sort of care. I've heard, as I've travelled round over the 10 or so years that I've been visiting, I've heard lots of very sad stories, stories like we've heard today, stories that you enacted for us so well. And it breaks my heart. And I know it doesn't have to be like that. Palliative care, it can't cure people. And we can't say to everybody, you will have no pain, you will have no suffering. But what it can say is, we will walk on this journey with you. You will not be alone. Not just the patients, the people with the condition, but also the carers and the people you work with. We will help you. We will do all we can to make sure if you feel sick, we will reduce the sickness. We will supply you with food, the bag of the food. Hopefully we'll find it a little bit easier to open the bag. Hey. We will give you incontinence pads if that's what you need. Or we will just sit and we will hold your hands and we'll talk to you. We don't know what is going to happen, but we will make it as comfortable for you to go on that final journey when that final journey comes. And I've seen the comfort in people's eyes, like we saw in the actors today, when they heard that reassurance that we are not alone. So we are advocating, and we are meeting people like you, we're meeting decision makers, we're meeting family. Because our mission is to see in Lesotho patient-centered, holistic care delivered with compassion, and that word compassion is so important, dignity, respect, and confidentiality. Being able to say, what you tell us stays with us. We're not going to go and shout it out. We want to empower health professionals. We know a lot of health professionals have not had any training in palliative care. They're taught they may be very good at diagnosis, they may be very good at treatment, but we know there is so much more. We already have a shining light in Lesotho with the work that Dr. Hassan and his colleagues are doing in Sekatana, bringing hope and bringing relief to so many people suffering with advanced disease. And we want to ensure that those with life-limiting illness should be supported to know what's going on. We heard today from May how when people first spoke to her, she didn't understand what they were saying. We will help people to understand what is going on and what is going to come and how we can help them. So we've done advocacy, we've done training as you heard, we've done online training, we're planning to do face-to-face training. We're very keen to support the National Health Training College with their palliative care section, which we're absolutely delighted to hear that that's going to be incorporated into the training. What we are asking from the people that make decisions, that we need trained multidisciplinary teams. That training is not complicated, but people need to have the mindset and understand what palliative care is and be committed to it. We do not want to stand alone. We want our services to be integrated into the mainstream services already available in Lesotho. We want improved access to morphine. If there's one success that we hope to see in the next year or two, is the availability of morphine. There is so much fear and anxiety about morphine. I know that. I remember having that experience when I was a young medical student as a young doctor. But now I prescribed it happily, in small doses, in big doses. And I've seen the relief that patients get from morphine. It is a good drug for pain relief. It is a safe drug, providing it's prescribed carefully and sensibly. We have it in Lesotho, but we don't have enough of it, and it's not available to most people in pain with advanced disease who need it. So our aim is to make sure that that changes as soon as possible. We also want access to laboratory tests, because even if you've got advanced illness, you're still entitled to have tests to know what's going on in your body. The tests help to ensure that where there is treatment, the treatment is the right treatment. And that means that the treatment is the cost-effective treatment. And that means we save money. But I know at the moment many people do not have access to laboratory tests. And we want to stress the importance of social support. We've heard it today already. We want to see that social care and social workers are integrated into our palliative care teams, our full members of palliative care teams. And we've also heard of the importance of grants, of money being provided to families when that's necessary. Hopefully we can get some of these people with illness back into work, caring and looking after their families. We can ease their pain, we can keep them moving with physiotherapy. If we can get them to handle tools again with occupational therapy, they can go back to work and continue to look after their families and have the self-respect that comes to it. So, I'd like to suggest to you that the future is bright. It's going to take time, but just hearing the passion and hearing the enthusiasm and the wonderful stories and not so wonderful stories that we've heard today means I think we're on an unstoppable journey. But we need you behind us, pounding the doors of the decision makers, saying this is what we need, this is what we can do, and we want to do it with you. Hear the book.
Since 2017, 2018, we signed a memorandum of understanding. That has been an incredible journey, and every journey has got an uphills, detours, delays, but we are grateful because they are still committed to the cause, as evidenced by their commitment even today that we are here. Also to appreciate the whole entire government of the Kingdom of Lesotho. Our patron is Her Majesty Queen Nemasnati, who is very much passionate about the total care that is received by the many of our people, many of our citizens that are marginalized, that are vulnerable, that need more support. We also want to appreciate the whole administration in different sectors. As Maneo has mentioned, they are part from the public works as a group of individuals. From their personal commitment, they gave to us their expertise, their knowledge and skills, their talents and abilities. That was their present and the gift for the nation through Starlight Vision. We also want to thank the Ministry of Defense since 2020. They committed that as long as we have got a brick and a mortar, their hands will be ready to put the building for Basotho on the ground. That still stands. Because sometimes plans can be made, but along the way changes can direct them, but they are still committed. And we thank each and every one that made such a decision for the benefit of us all. We also want to thank the Ministry of Water Affairs. Since 2021 early, they committed that since Makaka, where our home is going to be, is out of the urban area, is in the rural, and we haven't got the water mains up to that place, that they will do every possible measure to ensure that our facility has got running water, and they are still committed, and we thank them for that. We want to really appreciate different partners that are really willing to really commit. Some of the negotiations are in the very early stages, some they are halfway, and therefore we will reserve and respect that moment for when the time is right. But we have got many committed people that really want to do something to make the vision happen. We want to thank our government. I will say it so many times because they are indeed very supportive. I only arrived on Saturday night. Dr. Paul arrived on Tuesday. But we requested our House of Law at the National Assembly of our kingdom, just to send a little request if it is possible, just to raise awareness as one of our pillars. We have got 4 pillars that govern our services. It is advocacy, it is education and training, it is care and support, and finally treatment. But on the very same day we sent the letter, we were indeed acknowledged and given their time. We know they are very busy people. They are there to serve us. They are there to really bring about the concerns from communities and constituencies, to discuss them at the national level and find solutions for us. But they still found time. We therefore thank them for that opportunity, which is very rare. We don't take it for granted at all. It is a rare opportunity, but a valuable and an opportune moment to really raise awareness about what are the needs of the nations. The patients that are weak and feeble, unable to stand like I'm standing, unable to have a voice, and unable to have energy. Going through a lot of treatments may have given us a hair journey. Treatments that make them feel fatigued, weak and in pain. Therefore, they don't even have time to go to the radio station or write to a content for the newspaper or even approach offices to really appeal and stage their concerns and challenges. After all, we know how we are as people. You don't want to put all your problems out there. Anyone that puts the problem out there, you should know they have reached a point of being very, very desperate. But Starlight is the voice of the voiceless. It has been given the mandate to do that, and we can't shake it off. There were times when I was really frustrated, and I didn't know how we can make it happen. Because everybody was approaching, can we register the charity in UK so we can get more support of clinicians that will help us establish services, so we can have a source of raising funds to support Lesotho. And it wasn't really happening. But there was something that really refused to give me peace. Anytime I feel like this thing is really not happening. Maybe the people that were saying is too big. Maybe they were true. But there was that woman. I think what brought my tears as they were doing the drama, it's like the divine was confirming something through the student nurses. It is the very thing that wouldn't give me peace and sleep. The vision I saw, which I needed to address when I captured the vision in 2010. Detoured around because I knew I didn't have the pocket. My pocket, like Madinel said, we all know is just one salary to keep the family running until the next paycheck. So it means there wasn't much that I could really talk about to make any dream come to light. But there was a woman who came time and time again in my visions as I was praying. I do have my quiet times, early hours of the morning when it's quiet at night. So one of the 2 a.m.s I was praying, and this was the thing I saw as I finished my prayers. There was this woman in a house by herself, lying on a thin mattress. It was cold, dark, no food, aching, pain and suffering. And she didn't have any kind of support, and nobody stopping by to see her and support her. And the issue was I got cancer, smelling and not able to do anything by herself, and weak. And anytime I see that, and I know Starlight can never be stopped. Because those needs of any of our children, the adolescents, men and women. We need to collaborate, we need to partner, we need to share this vision. It is the vision for the nation. When the divine drops the vision, it's not for one man, it's not for one woman, it is for many. It only becomes the heart that's just maybe ready at the time when the mandate is released. So Starlight is for all of us, and it is for all of us to make it happen, to address the care gaps that exist in our nation for our people. I want to thank the United Kingdom. We have got so much great support from the government of Wales. They even sponsored a medical doctor, a consultant in palliative care, who will be coming early next year to support.
All best people. So that's why we don't do it. But I saw that, for instance, Eswatini is not on the red list. So we need to be at least where Eswatini is. We need to get to at least that standard, because then we can start having more of these exchanges, and we've seen the benefits that has been accrued because we can see it through Tebello. So this is something that all of us need to work together for. The UK will continue to support healthcare in Lesotho. I hope that we will have further conversations about what we can do in terms of healthcare support around the country. So we have the contribution that is being made by Starlight. We have the contribution that is made by Donald Cumbria and the Welsh Government. The British High Commission supports some of that work as well. And we'll also be looking to bring in healthcare practitioners. NHS England has 2 healthcare practitioners at the moment in the UK, in Mapoteng, supporting healthcare in Mapoteng at one of the hospitals there. We will continue with this. We want to do more. We want to do more potentially with clinics around the country, but we need to have these conversations to work out exactly how that would take place. And I think that the 200th anniversary of Lesotho's founding and the wisdom that was brought to the world by King Moshweshwe is the time to make bold, radical change for Lesotho. Is the time to look forward to the next 200 years. 200 years where Lesotho will go from its position where it is, which there are many great things to this country, to realizing all of its potential and being a wonderful place that everybody wants to be in. I love being in Lesotho. I hope to build a house here. I want to build a nice big round house, a rondavel, but I want it with a lovely mountain view. But in order for me to build a house here and to live here, I need to know that the healthcare provision is going to be fine, because for me and my family, I need to make sure that we're going to be fine, and we will be. So I'm relying on all of you, all of the next generation of healthcare leaders as well, to look after me and my family, because I've decided I want to have a house in Lesotho and a house in Scotland and never see winter. Always go between the two. But the healthcare provision will matter, and we'll need you. We'll need you to be there for Lesotho in the future. Let's create as many opportunities as we can. Let's create opportunities and partnerships. Let's build on what we have. I hope that we will hear from the World Health Organization. We'll hear from the Minister as well. But I think I want to go back to thanking Tebello and to Starlight for opening the door to the Ministry, to all of the officials here, to the future healthcare leaders, to my good friend Dr Myres, and everything that Donald Cumbria does for the partnership between Wales and Lesotho. And I look forward to seeing Starlight delivering next year, seeing real change being made in people's lives, and seeing palliative care being part of an overall picture of an improved healthcare system for Lesotho, and I look forward to living here as part of that. I'll stop there. So,
thank you, Dade Hari. What is your Sesotho name?
You tell me.
Thank you. While I'm still waiting for the information Young Minister. It's high time now I have the liberty to.
Thank you, Director of Ceremonies. Allow me to say all protocols observed. As fellow speakers have indicated, I acknowledge the presence of His Excellency, the British High Commissioner, Dr. MacDonald, the experts, the champions who have talked passionately about the need for palliative care in Lesotho, the flames of Starlight, and Tebello and Dr. Paul, who have put a lot of personal initiative into this agenda. I also note that there are very few of us, but I'm consoled by what I heard today, that it's the passion, it's the spirit, it's the heart. So it has come several times from different speakers here. That encourages me, and I want to believe come next year things will be different. I know that there are many who share the vision but are not able to be with us here. Members of the media, we also appreciate your presence, and the service providers, students from the college, and the beautiful play that you showed us, and surely we believe that the spirit in you will really help us forge ahead. You are the hope for us when it comes to palliative care. So, compassionate communities together for palliative care. The theme for this year's commemoration of World Hospice and Palliative Care Day cannot more than emphasize the reason we gather here today. I'm very honored to be here, and I'm very grateful to the government, but in particular to Starlight, who have championed this initiative. I've been touched by several speakers, as I indicated, and I believe that together we are going to make strides in what we're trying to do. This commemoration draws attention to the crucial aspect of healthcare that often goes unnoticed: palliative care. Palliative care, I can't define it better than the previous speakers here, but prevents and relieves suffering through early identification, correct assessments and treatments of pain and other problems, whether physical, psychosocial, or spiritual. Annually, around 57 million people globally are in need of palliative care, most of whom live in low and middle income countries like Lesotho. However, only 10% of those patients receive quality palliative care. This is alarming. Lesotho, likewise, is confronted with the increasing burden of non-communicable diseases, which affect not only the physical health of those diagnosed, but also puts a strain on the health system of the country. The high burden of cancer in Lesotho suggests the possibility of a good number of individuals enduring severe pain, as we have heard, and the need for the right palliative care measures. This country, therefore, needs urgent and concerted efforts to scale up access to quality palliative care services. Palliative care is not the last resort. It should be integrated early in the care of people affected by life-threatening conditions. WHO advocates for the fundamental human right for every individual to receive adequate and dignified palliative care. In recognition of this, WHO has resolved that palliative care is an ethical responsibility of any health system. Quality health services and palliative care are inseparably linked, and both are vital for achievement of universal health coverage. By embedding palliative care within primary health care, we will be ensuring that all individuals, regardless of their health status, location, have access to essential services and support. We must therefore transform the approach that we use to ensure that provision of palliative care in the country starts at an earlier stage of illness and at all levels of care, promoting better quality of life for our patients. Optimal palliative care in Lesotho will require the following. We need a supportive environment, policy environment. We need an empowered community. This is something that MDG alluded to in her remarks. We need research. We need to support research on palliative care. There's a big gap. We need to make sure that there is access to essential palliative care medicines. The colleagues who have spoken before me have mentioned the need for morphine, the scarcity of morphine in the country, and also healthcare workers not being comfortable to use morphine. We need a strong education and training system for palliative care workers and professionals, and the attention to the quality of palliative care services. As a way of addressing these gaps, WHO has recently released resources to support countries in assessing the development of palliative care and improving the quality of palliative care services. I would like, therefore, to call on government, healthcare professionals, partners, civil society, communities to collaborate to develop clear policies, guidelines, standards, to build the capacity of healthcare providers and caregivers in the communities, and to raise awareness to ensure that palliative care becomes an integral part of the health systems in this country. In conclusion, I would like to urge all of us to strengthen our efforts and to commit ourselves to ensuring that every individual facing life-limiting illness in Lesotho receives the compassion, the care, and the dignity that they deserve.
So while in the desert, having carried water and then all that, then they got finished. She was afraid that the child was going to die. But the child's name in Hebrew was Ishmael. Ishmael means God who can hear. So while she's there, she's waiting for the child to die because of thirst. The angel comes asking the simple question, why are you crying? And she says, I don't want to see the child die. But the name of the child was responding to a thirst for hope. Ishmael, God who sees, or God who can see, or God who is seeing. Then the angel says, there is an oasis of hope, not far from where you are. Because the oasis is a well, it's a spring in the desert. So the issues of palliative care and the issues of the people suffering, they come at a time when things are desperate, when things are difficult. all these entities, the Ministry of Health will go into the Parliament talking about this budget and that budget. It's dry. It's not easy. But this part comes at a time when I hear a couple of partners, Banda, Harry, saying, we are here also to support. Mphunyane Medineo, they said, we are here also to support. Myres, one of the problems I have and challenge that I have a big one, all the times he said, why this program, so many programs can't be, when you have a beautiful, what you say, you are integrating. Why do they take that shape even from the onset? So that one new program can be attached to the already integration that is taking place. But all the time, they come in bits and pieces. So we have to deal with this, put fires off here and there. Why is this concept not put together? Dr. Harry, you mentioned something about Dr. Banda. You need to deal with that with the Ministry of Health and with ourselves too. This issue of the Lesotho being on the raid. The Nurses Association went to the Parliament and they were explaining that we have almost 600 people who are not, nurses who are not working. And they can't get to work because of WHO. That's the message that they Banda. So you need to go and work on that. But maybe in a better way, or saying, guys, please, let's try to rotate. At Maluti, we have an example of that. If somebody went to UK, came back, he's a matron of the hospital. That recycling and that moving around, I think it needs to be appreciated. There was a time when I had an operation some years back. I lived in pain for weeks. And some years later, when I was working, I had a medical aid. I had another operation that affected the nerves, and I never experienced pain. I'm saying this because of what the call said. Why did I not experience pain? Because I went to the Mediclinic with a respect for pain management. And what he told me is that if you are poor, your pain is different from the one who can afford. And I'm saying to the health workers, I look at this and I said, but why? Why, when we are aware of these things, we let them go on as if nothing is wrong with them? But there's something wrong that a person from my village, we have the similar disease, but she experienced excruciating pain. And I don't experience any pain, simply because of the treatment and the access to resources and affordability. It's the same with the patients who are having cancer. There are those who don't experience what others are experiencing. And I think that's what Malichaba is saying. He said, can we put these things together? The access to methane is crucial. And we need to do the policies and the laws around those as a respect of a human right, a right to health. It should not be a talk that we say is there, but it should be something that we can put into practical terms. Our resources, I'm talking about domestic and both foreign resources, should be responding to the plight of the people of Lesotho. Not just to the projects, not just to the policies of the government, but to the needs of the actual people who are suffering. And I'll repeat again, Myres and the Banda, unless we have an active program in research, we cannot respond well to these issues because we'll be lacking the data to make decisions, which helps us to improve the policies and the laws around these issues. So healthcare workers, I know you are faced with the huge challenges of not being empowered to make a decision in many times. But I want to tell you, those who don't have power now, later on they have power, and when they are in power, they fail to do what they wanted to do when they were still struggling as officers and junior officers, seeing the plight of the people. And that's the problem. And I hope some of you, some of the officers we are all now, they will come and they will leave and you will come. Please change the situation to the needs of the people who are suffering in Lesotho. Thank you.
My minister is not here. Unfortunately, he had to attend an urgent meeting, but I'm here to speak on his behalf. Compassionate communities for palliative care, which means together we need to collaborate and implement with all multi-professional, multi-sectoral, multi-collaborative and partnership with effective strategies for provision of palliative care services for universal health coverage. It was last year when Malichaba and her team were here in Lesotho at the Royal Palace to launch this. But I'm glad they are still together to make sure that this is fully implemented in Lesotho. And they have done several efforts to ensure that we are all engaged, training, capacitating health workers. We compliment you, Malichaba, and your team for the efforts that we have done. The Ministry of Health and the government of Lesotho is receptive of and dynamic to partner and collaborative with organizations, public and private, whether local, regional or international, through the PPP policy and strategy, and hence we have the memorandum of understanding with different organizations as evidence as it is with our collaboration with Starlight Oasis of Hope Hospice. Our partnership is on cancer care, palliative and hospice care for our beloved citizens who are challenged by chronic disease. When they are here, they are even here to, maybe sword training will be done very soon, where they have a beautiful site. And we applaud you for the effort, Malichaba and your team. The Ministry of Health and the government of Lesotho commits to develop and execute the evidence-based policies and guidelines and support with regard to palliative care and hospice care in Lesotho in line with international standards and guidelines. Let me just give you an example of our commitment to healthcare service as Lesotho. We have, under the leadership of Honorable Selibe Mochoboroane, we have changed the approach, our strategy, maybe to strengthen primary health care, to integrate all health services. That activity started in March this year, and very soon we'll be engaging all the local authorities, all the health partners, everybody in the communities to ensure that together we fight or we win whatever the battle we are in. But our aim is to ensure that there is clear collaboration, there is clear reporting of our health services that we provide at community level. We are proud to announce that Lesotho is rolling out capacity building sessions of multi-health and social professionals as evidenced by 2 batches which have been conducted virtually by Starlight Oasis of Hope, Hospice and international partners from UK, USA, Uganda, Kenya, South Africa and others I've mentioned. It was virtually done. And we have the participants were about 220. Those included the health workers, pharmacists, medical doctors, nurses and social workers, nutritionists, all health workers contributed and participated. The Ministry of Health is charged with the responsibility to spearhead the review of multi-sectoral integrated strategic plan for the prevention and control of non-communicable disease. Health is a national priority and to address the social development goals, which will include SDG 1 of no poverty. I'm inviting the social cluster of the Parliament of Lesotho to review and act and regulate related morphine availability and other essential medications. Government want that to conclude, because there is a lot that we can say today. The Ministry invites the existing and new partners to join our palliative care journey, as well as establishing a collaborative approach and consortium with business community, other professionals like teachers, architects, everybody with skills to address the needs of the children and others who need palliative care. On that note, let me declare this commemoration official open, as health activities will continue today. Ke a leboha kgotso, pula na.